President Trump again last night at his rally in North Carolina says we are turning the final corner in the coronavirus fight. The numbers, though, tell us it is nowhere near that simple. Let's just go through and take a look. Number one, today or tomorrow, we will hit a very sad milestone in the United States of America. 200,000 Americans killed by the coronavirus. 200,000. We will hit that number today or tomorrow, and all the projections tell us we will go higher and higher and higher through the end of this year. You see how sad. In April, 50,000 deaths. By July 28th, 150. We're 199,000 plus today. A sad milestone just ahead. That is because of the case curve here, and there are some troubling signs in the data in recent days. Go back before the summer, we had the new infections down to about 20,000 a day. Then this horrible post-Memorial Day, post-July 4th, the surge up to nearly 70,000 cases a day in the middle of July. A slow drop down, and we thought we were going to stay below 40,000, perhaps pushing the baseline down below 40,000 new infections a day. But look, back up in recent days here, a troubling sign. Post-Labor Day into the cooler weather, a troubling sign in the case count starting to head up there, and this tells you all you need to know. 31 states reporting more new infections this week compared to a week ago. 31 states heading in the wrong direction when the president says we have turned the final corner. 15 states holding steady. 4 states trending down. And you look at this in the map here, 25 states are reporting more positive tests this week than last week. 25 states reporting higher positivity in the coronavirus testing this week than last week. Let's stop there and bring into the conversation Dr. Rajesh Shah. He is the Dean of the Brown School of Public Health. And Dr. Shah, I ask this question every Sunday, where are we? When the president says we have turned a final corner, when you look at several days again back at or above 40,000, and when you look at 25 states saying the positivity rate higher this week than last week, which tells you inevitably there are more cases coming in those states because when so many people are positive, more people get infected. Where are we?
Yeah, so good morning, John, and thank you for having me on. You know, a couple of weeks ago, as we went into Labor Day, we were talking about exactly this and our worry that coming out of Labor Day, as we've seen out of Memorial Day and July 4th, we'd see an increase. And I was hoping that the third time was going to be the charm. We were going to learn and not do this. And yet it does look like cases are starting to rise again. And unfortunately, we're walking into the fall where weather gets colder. We're going to spend more time indoors. So this is not where we want to be as a country right now.
Not where we want to be. And I just want to put up the testing trend in the sense that you and I have talked for months now about your concern the United States is not testing enough, number one, and then there's the confusion over the guidelines, number two. Testing has been pretty level at about 800,000 tests for a long time. Above that, a couple of days above that in recent days. I know you think it should go even higher than that, but is testing adequate, number one? And then this last week, we had the politics of all this played out right before our very eyes. A few weeks back, we talked about the mystery. Why was the CDC suddenly suggesting asymptomatic people who believed they had been in contact with somebody with COVID should not be tested? Then we learned it was political influence from the president's deputies at the Department of Health and Human Services. And then they flipped it again and essentially went back to the original guidance. There's still confusion when it comes to testing.
Oh, there's a lot of confusion. And it's unfortunate because if you listen to the scientists, including the scientists at the CDC, we've all been pretty clear that people who've been exposed, even if they're asymptomatic, need to be tested. But to your question of do we have adequate testing, the question is adequate for what? Do we have enough testing so we can get kids back to school safely? Nope. Do we have enough testing so we can get college students back to campus safely? We don't. Do we have enough testing for first responders, for nursing homes, for prisons, for workers in factories? The answer to each of those questions is we don't. And yet we keep hearing from the administration we have plenty of testing. As long as you don't want to test and protect those groups, I suppose you could argue we do, but we clearly don't. Everybody knows it. And we've got to keep pushing on trying to drive testing up.
And as you know, the president, he can't change these numbers. He has tried with tweets and with false statements and the like, but we're about to hit 200,000 Americans dead. And when you look at the case trends coming up, 31 states now reporting more new infections this week than last week. The president in the briefing room the other day suddenly said that, yes, there will be a vaccine soon, and yes, it will be mass distributed by April. Listen.
As soon as a vaccine is approved, the administration will deliver it to the American people immediately. Distribution will begin within 24 hours after notice. Hundreds of millions of doses will be available every month, and we expect to have enough vaccines for every American by April.
The president told us months ago the virus would be gone by last April. Is it realistic to believe people will be able to get on a big level vaccines by next April?
So I do think that we're going to see large numbers of Americans getting vaccinated by kind of late spring, summer. So April, May, June is not, I think it's not out of the possibility. But the first thing we got to do is make sure that the vaccine is safe and effective. We haven't seen those data, and I remain concerned about political interference in that process. But assuming that the scientists get to drive that process and we have a vaccine, I think very few people will get vaccinated in 2020. It'll start ramping up early 21. And sometime in late spring, summer, a majority of Americans will have access to a vaccine.
I hope that works out that way. Dr. Ashish Jha, the Dean of the Brown School of Public Health. Sir, thanks again for your important insights this Sunday.